be your student nurse for today. May I know your name, ma'am? Okay, great. You're Miss Rose. So, we're going to assess you from head to toe. Okay lang po ba sa inyo? Okay, I'm going to assess you from your postpartum. So, ma'am, the postpartum assessment is to prevent the possible escalation of health complications or to identify if there's an early signs of complications. So, it includes touching your breast, your abdomen, your legs, and checking your pant. Is that okay with you, ma'am? Okay. How do you feel right now with your breast, ma'am? Okay. So first, I'm going to palpate your breast. Can I remove your blanket? The breast appears symmetrical and even the skin throughout. There is no redness present and no signs of infection. So I will palpate starting near the center and working my way outwards in a circular motion. And palpate also the axilla. Is there any tenderness? I'm also checking whether the breasts feel sort of firm. So my patient told me that there is no tenderness. The breast of the mother is in a well condition. Next, I will assess the bowels if Mom Rose has been urinating regularly since she delivered. I will ensure if Mom Rose is flat in bed while assessing the bowels as well as assess the bladder and uterus later on. First, I will ask my patient what their usual elimination pattern is. It is different for everyone, but I want to make sure my patient is close to their baseline. I will ask to see if any laxative were used during pregnancy and see if they continued using them postpartum. I will ask my patient if they recall their last bowel movement. If they delivered that same day, it could be 2 to 3 days before their next bowel movement. If they have not yet had one since delivery, I can ask if they have been passing gas. Later in the assessment, we will ask about pain in the perineal area. Sometimes the patient may fear going to the washroom because of the pain it may cause. So, ma'am, I'm going to auscultate the bowel sounds of your abdomen using the diaphragm of my stethoscope in all 4 quadrants of your abdomen. I can hear 5 to 30 bowel sounds a minute, which is normal. Next, I will assess the bladder. I will ask my patient if she has urinated since delivery, and if yes, when was the last time. If my patient had an epidural, I want to ensure that she does not have any urinary retention. She should be avoiding within 6 to 8 hours after delivery. I will ask my patient if they have any pain while urinating or dysuria. I will ask if they have any increased frequency or urgency to urinate. And if they have noticed any foul odor, these are all signs of a urinary tract infection. UTIs take time to develop, so this would not be present if the patient has recently given birth. Rather than a few days to week afterwards, either way you should be asking this question, as the patient may also feel a burning. Due to laceration, I will ask about the color of the urine, which should be a clear yellow. I will place one hand at the symphysis, pubis, and another hand above the umbilicus. I will work my way down until I feel the bump, which is the fundus, which is the top of the uterus. Within the first 24 hours postpartum, the fungus should not be at the level of the umbilicus, known as the over of it, where the centimeter above, it will be 1 over u. If it were 2 centimeters below, it would be u over 2. The fundus should be the midline and not deviated to the right or left, which could indicate that the distended bladder, the fundus should feel firm to touch and not baggy. If it was in the higher position than expected, then this could be indicate uterine acne. Once nursing intervention to help with this includes a fundal massage. Next, I will assess the lochia, the vaginal discharge. Ensure gloves are applied as you will come into contact with bodily fluid. I will ask my patient to show me their pad and ask them when is the last time they changed it and how often they are changing it. I will note the color. In this case, the lochia has rubra, a dark red, which is normal within the first 1 to 2 days postpartum. You also want to know the amount of lochia on the pad. Can I see your pad, ma'am? Okay. So, I will note that the color, in this case, the lochia rubra, a dark red, which is normal within the first 1 to 2 days of postpartum. You also want to note the amount of lochia on the pad, which will be identified as scant-like, moderate or heavy. In this case, my patient lochia is a moderate amount. Heavy is when a pad saturated within 2 hours, which would be concerning. Serosa color is a brownish red or pink, which is normal within 4 to 10 days postpartum. Alba is a yellowish white, which is seen after 10 days postpartum. You also want to make sure that the color is progressing towards a lighter color. Note that each brand of pad absorbed differently. Is also want to make sure to turn my patient on the side to make sure that there is no lochia leaking and pooling under the sheet. I will now check the perineal area for any natural tears. If an episiotomy was done, it is best for my patient to be turned to the side so I can see the whole area. I see minimal swelling and redness, which is normal for a fresh laceration. There is no drainage present. The edges are well approximated. So if there were sutures, I would ensure that they were well intact. I will ask my patient if they have any pain in the area or also palpate for any discomfort. So lastly, I will check the rectal area of hemorrhoids. I will note the color and the amount of hemorrhoids present. In this case, the hemorrhoids are a dark red color and there are 5 hemorrhoids present. As I've just touched the pad and perineal area, I will remove my gloves and wash my hands. Next, I will assess the legs. So no redness is noted on the legs. My patient denies tenderness while I palpate. Skin temperature is even bilaterally and warm to touch. No pitting edema is present, and it can be normal for the mother to have some edema, but should be minimal and should improve with time. If my patient had a tender area that was a red hot to touch with pitting edema, so I would be concerned about possible deep vein thrombus. I also want to address my patient's emotional state. I will ask my patient about their general mood and if they are experiencing fatigue. And it's normal for the new mom to feel tired right after labor, but they should still be able to care for themselves and their baby and be generally happy as patients are.